prior to the pandemic, for example, 86% of ER doctors in Canada experienced burnout. 14% contemplated suicide during their career, and of those, almost 6% actively considered it in the past year. These numbers shock me, and they should. However, this, it seems, is the reality of those working in our ERs. And sadly, for one Quebec ER doctor, the stress was just too much. In January, Dr. Karine Dion, a young 35-year-old mother, wife, and ER doctor, took her own life. Today, we're going to be speaking about the mental health toll, not just on our children, the elderly, and families, but also focus on the mental health toll of our healthcare workers. We'll be speaking with Dr. Tim Lau from Ottawa, who's an associate professor and psychiatrist with the Royal in Ottawa, one of Canada's leading mental health centres. But before we get to Dr. Lau, we will be speaking with David Daigle, the husband of the late Dr. Karine Dion, and her sister Geneviève Dion. We will have a translator for Mr. Daigle for this interview, as he will be speaking in French, so please be patient with us. David, Geneviève, thank you both so much for joining me today. I want to offer my condolences. I can't even imagine what you're both going through, what your family. David, you have a young son with your late wife, with Karine. I can't even imagine how this is impacting your family. But I really am grateful that you've come here to share your story today, because I think we all need to know what is happening, and Dr. Karine's story must be heard. So thank you so much. First, I think I will start with you, David. Your wife, she's first of all, beautiful woman, beautiful. I've seen so many photos of her in the last few days, and it sounded like it was a very big struggle for her, and she was very passionate about her work. And with COVID, everything just became too much. Could you share a little bit about your story of your wife?
Ma femme Karine, c'était quelqu'un avec un grand cœur. Elle voulait aider tout le monde, elle voulait sauver tout le monde. C'était un médecin hors du commun parce qu'elle ne faisait pas la même pratique souvent que qu'est-ce que les autres faisaient. Elle le faisait avec son cœur. Elle voulait vraiment que les gens soient le mieux soignés possible. Puis, c'est ça. Elle était vraiment humaine dans sa façon de pratiquer.
Yeah, my wife had a great heart. She loved her work. She went the extra mile, you would say, by working in her field.
Continue, David.
C'est ça. Et puis, elle était comme ça aussi dans la vie avec moi et mon fils et sa famille. Elle voulait tout le temps aider. Puis, du moment qu'il y a quelqu'un qui avait un petit problème, elle voulait tout le temps que cette personne-là soit soignée le mieux possible. Qu'elle
she was a very generous person, had a beautiful heart. She was the same way in our family. She was always willing to help out anyone in need.
And Geneviève, your sister, she was always passionate to become a doctor. This was always her goal, her dream.
Yes, and she was very young. I remember my mother, she was in elementary high school when she just said, okay, I want to be a doctor, because my other sister had a bike accident, actually, and she was worried and a bit angry about how she was treated in the hospital, because she experienced a lot of pain, and my sister, I think she was very touched about that. So she wanted to be a doctor to make a difference and not let people suffer like that, to be treated like that.
And it was always her passion to work in an emergency room, Geneviève?
Actually, she was a family doctor, but she always worked in the emergency room. And when she moved to Granby with David, she only doing that.